performing the Supreme Lifting Peel on our student today as a demonstration to show how beneficial trichloroacetic acid can be for retexturizing the skin, lifting fine lines and wrinkles, purging the hair follicles. Our student here today, her skin, we've been working on her skin. We've done so far on her skin in this 3-day cosmetical class. We have performed microneedling, we have performed dermaplaning on her skin, and level 101 peel. So her skin is what we would call highly prepped for chemical peel, and that would be our TCA peel. So while she's gotten really good results just in the days leading up to this, what we call finale treatment, it's going to be an even greater result for her, but she will see some frosting and blanching of the skin that is going to create that corneocyte release. So peeling, she'll have visible peeling from this procedure, and after about 5 to 7 days, she will see somewhere between 5 to 7 years reversed on her skin. So we're going to turn back the clock for her. She's going to be so happy. We call this the Supreme Lifting Peel because it's a 20% trichloroacetic acid, and it's the most highest performing peel we have in the Institut DERMed brand. Her skin is clean, well prepped, as I mentioned, just from training. And remember, we do things here in class on each other that we would not normally do on paying clients. So to have her experienced this number of treatments with the needling and the dermaplaning and the peel in a short period of time is not normal. We usually would do the needling and the dermaplaning, and then approximately 2 weeks later we would do the peel. But she's going to have a great result. I promise. You're going to love watching this. I'm just going to clean her eyes first because she's got some mascara here, and I just want to get rid of all that. So what I'll do, so that everybody gets a chance to practice, is I'll put on the first layer, let that process, and then we'll probably be able to do at least 2 layers on her skin type. And so you all can take turns doing the next layer. A little bit of protective cream on the back of my glove. And I'm just going to lift up your eyelashes. I'm going to put the protective cream right in the tear duct area. I want to treat with my peel right up under these eyelashes here, so I'm not going to drag it across underneath the whole eyelid. Take the rest of it. You could also use your lip balm as well. Put a little bit right on her lip. I want to put it right there in the corners of the mouth so that I don't have any bleeding of the peel in past the vermilion border. I'm going to work with it right up to the vermilion border. Her lips will be a little bit puffy tomorrow. So I don't want to go over it. I just want to go right up to it. Put a little bit right inside the nostrils because I don't want it traveling up into the nostrils. Okay. right, so when we put the peel on your skin, I'm going to be working very fast, and your job is to keep your eyes closed. Okay? I'm going to be watching your physical response to the peel. With TCA, because it's a large molecule, it usually goes in the skin fairly slowly. So in other words, it takes time for the peel to turn on. Now, because your skin has been so pre-prepared with the needling and the dermaplaning and the pre-peel, it may go in your skin much quicker than it normally would. But one way to determine if someone is a candidate for a deep epidermal peel is to not do those layers of prep, or to spread out the time. So you would do the layers of prep and then wait a couple weeks, let the skin completely recover from those prep steps, and then put the peel on without any prep, possibly just the buffing, which I'm going to do now. Okay, so I'll just watch you, and just know that I'm going to keep you comfortable during this process. So the peel gets very hot as it begins to turn on in the skin, and you may have a little bit of tearing. I'll watch that, and we'll be able to control the tears. I can use a fan on your skin, a hairdryer and cool shot, which helps to keep you very comfortable. I can also use an ice water bath on your skin with my ice water roller. So I'm well prepared to handle whatever you're feeling. Okay? Just to make sure we don't have any oil on your skin. So this is the peel prep. I'm going to get that little lesion right there above her eye, trying to knock that out.
What is in the peel prep, Lyn?
The peel prep is a 5% glycolic, lactic, and salicylic acid. And so it's an excellent way just to remove the dead skin cells, get the dirt and the oil off of the skin that prevents absorption into the hair follicles of the peel. So I'm going to do a little bit more.
So that's good to use before your skincare sometimes. Other clients.
See how I'm kind of holding the skin down? Everywhere I'm working, I'm just anchoring very close to where I'm doing the buffing. And then it doesn't feel like the client is having it, like it's too rough.
That's pretty amazing after all the prep she's had, that's still...
Well, think of it this way. We did the dermaplaning and the needling, and we did a very mild peel along with the dermaplaning. That's going to kick up a lot of cell debris. And that cell debris doesn't necessarily just exfoliate itself right off. It still wants to hold on to the surface of the skin. That corneocyte glue is really strong. And so I think what we're seeing here is we're seeing the dead skin, superficial dead skin cells that are ready to come off. They just haven't quite come off yet, which is a case for after you're doing these clinical facial treatments. About 3 or 4 days after a clinical facial treatment, you want to have the client do the microcrystal polish. Even if they don't use a peel with a microcrystal polish, just use the peel and the mask at home, or the peel and a serum at home, because it's going to manually exfoliate those dead skin cells that became loose as a result of breaking down the glue, the corneocyte glue, but they didn't quite come off. So that's really what we're seeing here, is a release of more dead skin cells. So she's going to get a really, really, really good result. But look at her skin. Look at how it changed colors just from doing the buffing. So I think I'm going to do a little more of this buffing.
And you are going to Alaska.
Let's do underneath your chin. You can do right under your nose. Just hold your top lip down. There you go. Make sure you do a good job of that. Now she has some wrinkles around her eyes, and we want to make sure we really give her a good outcome around the eye area. So I'm going to spend a little more time working on that. See, we're still getting a little bit of debris off her skin. So let's see, lift your chin up. I'm just going to do your neck, because we'll put the TCA down on your neck as well, so we can blend the results from the face down. I wouldn't go any further, even though you're a great candidate for a TCA chest peel. I wouldn't go any further than the clavicle area, because with the TCA, if you cover too big an area in one session, that's when you can have some not really toxicity, but you just have too much product on one area at one time. You could even have the client or the patient come back the next day and put it on their chest. But don't do it at the same time. All right. Very nice. Yeah. Where do you want it? Back here?
Just have a view.
Okay, so take a look, Michelle. This is what we did on the first go around on your face.
Wow.
And then this is what we did more on your neck.
Yikes.
So your skin's starting to purge a lot, which is excellent. Just want to do. If you're going to subject yourself to this type of treatment, kind of like what Kylie did, you want to make sure you have a really good outcome. So, okay, we're going to let the skin dry. I want it to be very dry. Worried about it. So this is a rayon swab. This almost works like a squeegee. It will take the product up into the swab, but it'll release it, whereas cotton doesn't release it. Okay, job is to keep your eyes closed. I'm going to start on your forehead. I'm going to cover your forehead. Then I'm going to have you turn your head over to the left, and I'm going to cover this side of your face here. We'll go over to the right. I'll cover this side, and then I'm going to come down and do this T-zone area, and I'll finish your neck last, and I'll come back and do your eyes last as well, okay? So you know the directions I'm working. And I think you're going to be fine everywhere until we get over this area right here.
Is this still irritating?
So what I may do is work around some of these little places. I don't know. We'll see how you do. Okay. Job is just keep your eyes closed, and I'll do your top lip last as well. I'll do around your lips and around your eyes last. Okay. Just want to knock off the excess. You do want to make sure you have enough product on your skin, or on your swab rather. Cover that whole area to the hairline. Let's go this way for me, Michelle. Thank you. Not a lot of sensation in the back of the face here, so most of the sensation is going to be around the nerve endings, so I'm just going to get the back covered really well. Little cross-hatch motion. Let's go over to the other side. Come back this way. How you doing?
Okay.
Good job. Alright, I'm just going to come to the center of the face. Make sure and keep your eyes closed. So I want to be sure I'm just have enough product on the skin to make sure I'm covering every micron of tissue. You'll be able to see once it's completed areas that you missed, so you want to be very good about. That's what's good about putting a second layer on, is you can really get those areas that you might have missed. All right, we're starting to see that peel kick in now. I'm just going to do it around your eye area. Pull the skin down a little bit. You don't want to get it into the lashes, because then when they open their eyes, it'll go in their eyes. Done that. Just want to make sure you go up to that area where you put the, give her an extra little dot right there on that lesion there. Okay, good deal. She's very stoic.
This is a trooper.
Not everybody is this stoic.
Not me.
We're going to go right to the vermilion border. Do underneath the lip. How are you feeling? You need some cool air? All right, let's do the cool air and then I'll come back and finish your neck.